You are drinking your daily green smoothies. You are eating your almonds. You are taking your expensive, high-dose turmeric pills every morning to protect your joints. You are doing absolutely everything right, following all the modern health advice. So why are you suddenly lying in an emergency room bed, doubled over in the most excruciating pain of your life? I'm Dr. Robert Harrison. For decades, I have treated patients who just want to age well and live without chronic pain. But recently, I am seeing a terrifying and frustrating new trend. Health-conscious adults, specifically those over 55, are accidentally building literal stones inside their kidneys. And they are doing it because they fell for what I call the healthy biohacker's trap. By the end of this video, you will understand the critical difference between getting the incredible anti-inflammatory benefits of turmeric safely in your kitchen versus accidentally dropping an oxalate bomb on your kidneys with trendy, hyper-concentrated extract pills. I am going to show you exactly how to protect your joints without destroying your kidneys. But before we get into the exact mechanism of how this happens, I want to ask you a quick question. Drop a yes in the comments right now if you currently take a daily turmeric or curcumin supplement pill. Be honest, because if you do, you need to hear every single word of this. Let me tell you about a patient I recently treated. We'll call him David. David is a 58-year-old retired contractor from Denver. After 30 years of heavy lifting on job sites, his knees and lower back were constantly aching. Like many of you, David is a smart, proactive guy. He wanted to avoid relying on heavy prescription pain medications. So, he went online, read up on natural remedies, and completely overhauled his diet. Every single morning, David made himself a massive green smoothie packed with fresh raw spinach and almond milk. And right alongside that smoothie, he swallowed 2 premium, high-dose curcumin extract pills. Curcumin is the active anti-inflammatory compound found in turmeric. The bottle promised maximum absorption to melt his joint inflammation away. For about 3 months, David felt pretty good. He thought he had cracked the code. Until one Tuesday morning, David was just bending over to tie his shoes when a sudden, sharp pain shot through his lower back. At first, he thought he had severely pulled a muscle, but within 2 hours, the pain escalated to a level he had never experienced. It was so agonizing, radiating around his side and down into his groin, that he was actively vomiting and couldn't even stand up. His wife practically carried him to the car and rushed him to our ER. It wasn't a pulled muscle. A CT scan revealed a jagged 6mm kidney stone trying to force its way through a very narrow tube called the ureter. As he lay there in a hospital gown, exhausted and in disbelief, David asked me the same question I hear constantly from patients in his situation. Dr. Harrison, how is this possible? I don't drink soda. I don't eat junk food. I've never eaten healthier in my entire life. So here's exactly what I told David and what I want you to understand today. The health and supplement industry sold him a half-truth. Turmeric, in its natural root form, is a magnificent culinary spice. It has centuries of proven medicinal use. It genuinely does possess powerful anti-inflammatory properties that can help soothe arthritic joints. But the supplement industry looked at that natural root and decided it wasn't enough. They stripped it down, chemically extracted the active compounds, and concentrated them into massive, unnatural doses that your body was never designed to process all at once. They did this because natural turmeric is somewhat poorly absorbed by the body. So, they created these super pills to force the issue. But in doing so, they also concentrated something else, something hiding inside the turmeric plant. A naturally occurring, water-soluble compound called oxalate. When you use a pinch of turmeric powder in a curry or a warm soup, the amount of oxalate is perfectly safe. Your body handles it easily. But when you take a hyper-concentrated extract pill, especially when you swallow it right after drinking a spinach and almond smoothie, which happen to be 2 of the highest oxalate foods on the planet, you are creating a perfect storm inside your body. You are dropping an oxalate bomb directly into your bloodstream. And your kidneys are the ones that have to clean up the blast. To understand why this is happening, you need to understand what your kidneys actually do. They are your body's ultimate filtration system. Every single drop of your blood passes through them, and their job is to pull out the waste, balance your minerals, and keep your internal chemistry perfectly stable. Now let's talk about oxalate. Oxalate is a naturally occurring compound found in many healthy plants, including the turmeric root. In a normal, balanced diet, you eat some oxalate, it binds with calcium in your stomach or your intestines, and it leaves your body harmlessly through your digestive tract. It is escorted out before it ever becomes a problem. But when you take a hyper-concentrated turmeric or curcumin extract pill, you are bypassing that natural digestive safety net. You are flooding your bloodstream with a massive, unnatural dose of highly soluble oxalate all at once. When that massive wave of oxalate hits your kidneys, it is desperately looking for something to bind to. And what does it find circulating in your system? Calcium. When oxalate and calcium meet inside the delicate, microscopic filtration tubes of your kidneys, they lock together. They form tiny crystals. If you keep taking those high-dose extract pills day after day, month after month, those microscopic crystals act like a snowball rolling down a hill. They gather more calcium. They gather more oxalate. They grow into sharp, jagged rocks. This is not a rare medical mystery. Calcium oxalate stones make up roughly 75% of all kidney stones we see in the hospital. And in my practice, I am seeing a massive, alarming spike in these stones among seniors who consider themselves exceptionally healthy. Let me tell you about a patient I'll call Elena. Elena is a 61-year-old from Austin, Texas, who was trying to manage early arthritis in her hands. She wanted to do everything right. She snacked on raw almonds and dark chocolate for their antioxidants, and she took 3 highly concentrated curcumin extract pills every single day to stop the joint stiffness. What nobody told Elena is that almonds and dark chocolate are also extremely high in oxalates. She was taking her high-oxalate superfoods and stacking them directly on top of her high-oxalate supplement pills. She was unknowingly building a stone day by day until she ended up in my clinic with severe, agonizing flank pain. Or take Marcus, a 65-year-old former teacher from Seattle. Marcus didn't take pills, but he fell in love with those trendy, high-dose, golden milk supplement powders sold at health food stores. He was scooping massive tablespoons of this concentrated extract into his hot water every night before bed. Within months, he developed painful urination and microscopic bleeding. His urinary tract was literally being scratched by thousands of tiny calcium oxalate crystals that his kidneys were desperately trying to flush out. These are good, proactive people. They were simply misled by the supplement industry's dangerous obsession with the idea that more is always better. This is where I need you to take control. The next time you sit in your doctor's office, I want you to ask this exact question. Can you review my joint supplements and tell me if I am at risk for an oxalate overload? Write that question down. Bring the actual bottles with you. Do not assume that just because a pill has a picture of a natural root on the label, it is perfectly safe for your kidneys in massive, unregulated doses. If you have ever felt a twinge of back pain and immediately gone online to search for a quick fix, you know exactly what pops up next. The internet is absolutely flooded with kidney cleanses and detox kits. If you have ever fallen for one of those expensive kits or seen those aggressive ads, you are not alone. Let me know below in the comments if you've seen them. Because here is where I get genuinely frustrated as a physician. When older adults start worrying about their kidneys, they are immediately targeted by internet marketers selling detox teas, cranberry flushes, and apple cider vinegar magic potions. Let me be perfectly clear, and I say this with decades of medical training behind me. You cannot detox a calcium oxalate kidney stone with a $40 herbal tea. These stones are literally hard, calcified rock. Pouring an unregulated, untested herbal blend over them does absolutely nothing to dissolve them. In fact, many of these so-called kidney cleanse teas contain ingredients like high-dose vitamin C, and here is the bitter irony. Your body actually metabolizes excess vitamin C directly into, you guessed it, more oxalate. You could be actively making the stone bigger while paying for the privilege. Your kidneys do not need a cleanse. Your kidneys are the cleanse. They just need you to stop overloading them with hyper-concentrated extract bombs that they were never biologically designed to handle. So, does this mean you have to throw away all the incredible, joint-saving, anti-inflammatory benefits of turmeric? Does this mean you just have to accept your arthritis pain and rely on harsh prescription painkillers for the rest of your life? Absolutely not. The anti-inflammatory power of turmeric is very real. The science backing it is solid and thoroughly documented. The problem was never the plant itself. The problem was the modern obsession with extracting, concentrating, and pillifying it. There is a way to get all the pain-relieving benefits of turmeric safely. A method that protects your joints, completely shields your kidneys from oxalate overload, and costs pennies compared to those expensive extract pills. And the best part? The solution is sitting right there in your kitchen. The secret to unlocking the incredible, joint-saving power of turmeric without putting your kidneys in the line of fire is to return to how human beings have consumed it for thousands of years, not as an isolated, hyper-concentrated extract inside a plastic capsule, but as food. When you use turmeric as a culinary spice, something fascinating and protective happens inside your biology. If you consume a normal dietary amount of turmeric powder along with a meal, the natural oxalates inside that powder meet the calcium from your food inside your stomach and intestines. They bind together right there in your digestive tract. This forms a completely harmless compound that simply passes out of your body when you go to the bathroom. The oxalate is escorted out the back door. It never even reaches your bloodstream, which means it never reaches your kidneys. But when you swallow a massive 1,000 milligram curcumin extract pill, often on an empty stomach or with a green smoothie, you are completely bypassing that digestive safety net. The oxalates flood into your blood, travel straight to the kidneys, and start building those agonizing stones. So, how do we get the medical benefits of turmeric safely? I want you to write down this exact 3-step kitchen protocol. This is how you protect your joints and your kidneys at the exact same time. Rule number 1, the safe dose. You do not need massive quantities to reduce inflammation. All you need is 1/4 to 1/2 of a teaspoon of high-quality organic turmeric powder per day. This amount contains a fraction of the oxalates found in extract pills, an amount your kidneys can handle with absolute ease. Rule number 2, the activator. Turmeric on its own is poorly absorbed, which is why the supplement companies started concentrating it in the first place. But nature already provided a perfect, safe solution: black pepper. Black pepper contains a compound called piperine. When you add just a tiny pinch of black pepper to your 1/4 teaspoon of turmeric, the piperine actively dilates the blood vessels in your digestive tract and prevents your liver from immediately filtering the curcumin out. The result? That tiny pinch of black pepper boosts your body's absorption of the anti-inflammatory curcumin by up to 2,000%. You get the medical benefit of a massive pill, but from a perfectly safe, tiny amount of natural powder. Rule number 3, excruciating. Curcumin is fat-soluble. That means it cannot dissolve properly in just water or juice. To actually deliver that anti-inflammatory relief to your aching knees, hips, and lower back, you must consume it with a healthy fat. Mix your turmeric and black pepper into a tablespoon of extra virgin olive oil and drizzle it over roasted vegetables. Blend it into half an avocado, or stir it into a warm broth with a little bit of coconut oil. When you combine the powder, the pepper, and the fat, you have created a powerful, safe, natural medicine. No extract pills required. No oxalate bombs detonated. Now, while we are talking about keeping your kidneys safe from stones, I need to remind you of the 2 absolute baseline rules of kidney health. Because if you ignore these, even the best diet won't save you. First, you must give your kidneys enough water to actually do their job. Think of your kidneys like a high-efficiency washing machine. If you load a washing machine with incredibly muddy clothes, but you only let a tiny trickle of water run into the drum, what happens? The dirt doesn't wash away. It just cakes onto the sides of the machine, thickens, and hardens. Your kidneys are exactly the same. If you are chronically dehydrated, the minerals passing through your kidneys slow down, pool together, and crystallize into stones. You need a steady, robust flow of water to keep the drum clean. Drink enough water throughout the day so that your urine is a pale, straw-like yellow. Second, protect your blood pressure. High blood pressure is a silent assassin to your kidneys. It forces blood through your delicate, microscopic kidney filters with too much violence, permanently scarring them over time. Keep your blood pressure controlled, and your kidneys will quietly filter your blood for a lifetime. Inner open heart senses mardvers. Let's go back to David, my patient from Denver who ended up in the ER. It took him 3 agonizing days to finally pass that 6 mm calcium oxalate stone. When he came in for his follow-up appointment, he brought a plastic bag filled with his expensive super supplements and dropped them right into my trash can. We completely changed his routine. He stopped the hyper-concentrated extract pills. He stopped overloading his mornings with raw spinach smoothies. Today, David makes a simple, warm chicken broth infused with a half teaspoon of turmeric, a crack of black pepper, and a drizzle of olive oil. It has been over a year. His knees and back feel better than they did when he was taking the pills, because his body is actually absorbing the curcumin properly, and his latest kidney ultrasound Completely clear, not a crystalline sight. Health is not about finding the most extreme, highly concentrated biohack on the internet. It is about working with your body's natural biology, not against it. Your kidneys are working tirelessly to keep you alive and balanced. It is time we stopped making their jobs so incredibly hard. I want to know what you are going to do next with this information. Comment the words, "starting today," down below if you are going to throw out the extract pills and start using the safe, kitchen-based turmeric method. Comment, "asking my doctor." If you are going to pack up your supplement bottles and bring them to your next medical appointment for a proper safety review. Or comment, "sending this." If you already know a friend or family member whose supplement cabinet is completely overflowing and they need to hear this warning before they end up in the ER, please use the share button to send this video to anyone over 55 who is trying their best to be healthy but might be falling into this trap. Save this video so you can remember the exact turmeric recipe and make sure you are subscribed to the channel so you never miss out on the medical truths you actually need. I'm Dr. Robert Harrison. Take care of your kidneys, be smart about what you swallow, and I will see you in the next video.